There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
High blood pressure does not usually cause death. It is called silent killer because it silently brings you nearer to death by causing long-term damage to the organs like kidneys, eyes, brain, blood vessels, heart, liver, etc. The damage to the organs then reduces the functioning of these organs, which then predisposes the body to have complications when body is under physical or mental stress. Most of the body organs have excess capacity, which is 34 times more than what is needed to maintain essential life functions. Hence we do not feel anything when our body is undergoing some stressful events, as the organs can compensate for it. Long-standing blood pressure for many years can reduce the capacity to such an extent that even minor stressors can cause overload of the organs, leading them to have failure. Many of these events can be fatal, or your body can recover with proper medical management and treatment. Usually it may take around 1,030 years after the development of hypertension to reach this stage, but it can be averted easily if proper lifestyle advice and treatment for blood pressure is followed. Yes, taking medication for blood pressure does help in reducing the complication. So please take your medication even if you are feeling totally okay. It can cause death directly if your blood pressure reaches very high levels, in which case it can cause excessive loading on your heart or brain, which can then cause brain hemorrhage, excessive brain damage, or sudden heart failure. It can cause death directly or indirectly. However, there is no timetable for your death due to having this prognosis. Without knowledge of having it, it will be much more promptly than when diagnosed and treated aggressively. Treated aggressively means that it is closely followed at home with a blood pressure check on the part of the person with it, and taking their prescribed medicines as directed. Recurrent follow-up visits with their primary provider doctor. Besides alerting the affected person of a rise in blood pressure, this step makes the affected person accept the responsibility of the diagnosis and the responsibility of taking their BP med routinely, not episodically. This accepting of responsibility may include the always necessary step of losing weight, if this is a factor. Not all affected are overweight. Ceasing smoking, drinking alcohol, or other measures to regain a healthier lifestyle may also be encouraged. Therefore, a person with diagnosed and properly treated BP can live 40, 50 or so many years with it. I have for 35 years.